been a lot of changes in stroke medicine over the last 15 or 20 years. It's really difficult to pick out any individual big one. If you go back around 15 or 20 years, it wouldn't be uncommon for them just to be put in a bed on a general medical ward and given supportive treatment. Not all stroke patients at that stage even got a brain scan, which these days seems unthinkable. There are two different types of strokes you can have. It can be caused by blood clots in the brain or bleeding in the brain, and without a scan you've no way of knowing which one of those the problem is and therefore how to treat it. Around 10 or so years ago, what started to become more commonplace was clot busting treatment, and that is now the gold standard of care if people get into hospital quickly enough. It's taken quite a long time to get that the national standard that's delivered everywhere. And now what's coming in, just as we've managed to achieve that, is a new process called Clot Retrieval, where if we can identify in particular patients where the clot is in the brain, we can send them to a neuroscience centre where it's possible to actually put a wire into the blood vessels that go into the brain and pull that clot out. And if you think how far that is from where we came from 20 years ago, it's just amazing. So it's a combination of the more advanced technology, both the scans and the equipment that gets used, but also the familiarity amongst clinical staff and patients about the urgency of the problem, the need to get into hospital quickly. And if we look at the model that Northumbria have adopted using the Northumbria Hospital, everything is so set up there to identify these patients early and get them early access to specialist support, and that's the biggest difference that it's going to make in terms of saving lives and improving people's chances of recovery after stroke.